Hey guys, we hope you had a great winter break and a happy new year.
This week's video is on kidney transplants.
A kidney transplant is a procedure where the healthy kidney replaces an unhealthy one. Kidneys work to filter waste products that run through the blood. Dialysis is also pretty useful in treating kidney failure as it uses a blood filtering process. But it can be time-consuming, which is why kidney transplants are often more preferred.
A person usually requires a kidney transplant when they have kidney failure, which is when the kidneys are unable to perform their function properly. Kidney failure can be caused by many other things, and the most common cause is other health conditions that a person can have. Some conditions that can cause the failure of kidneys through damaging them are chronic kidney disease, diabetes, hypertension, which is a high blood pressure, autoimmune conditions such as lupus, genetic conditions which include polycystic kidney disease, nephrotic syndrome, and problems with the urinary tract.
Here's the process for receiving kidney transplant. Choosing a nearby transplant center, evaluation, finding a donor through blood typing, tissue typing, and cross-matching, going through the transplant, and recovering. First, you have to choose a transplant center that has a high success rate, low cost, and experience. Then you have to be evaluated to see if you're eligible for a transplant. They assess your health and other medical conditions in the past to see if they can cause a complication. This evaluation can be done through physical exams, x-rays, MRIs, and CT scans. Blood tests are also very useful. So you have to be accepted as a kidney transplant candidate. Then you must find a deceased or living kidney donor. But you need to make sure that they're a good match. Blood typing can be used to see if the donor is a match because it tests the compatibility of the blood types to make sure that organ rejection does not occur. Tissue typing is called human leukocyte antigen typing, and it compares genetic markers to see if the kidney will survive. And a cross-match mixes the both types of blood to see the reaction. These are the main factors to consider when getting a kidney transplant. Family donors are very helpful as most of them are a good match, but you can also get a kidney through paired donations. Paired donations can occur when a kidney that is incompatible to you is given to someone else and their kidney is given to you. The last option is the waiting list. It may take years until you can find a kidney that is a good match for you. Staying healthy before and after your surgery is vital as it prepares you for the surgery and recovery. You need to take medication that is prescribed, follow your diet, exercise, and keep in touch with your healthcare officials. During the surgery, anesthesia is registered to keep you under, and blood pressure and oxygen levels are monitored. For the surgery, the surgeon inserts the kidney on the lower part of the abdomen, and they keep the old kidney in place, unless there are kidney stones, pain, or other problems. Then the new blood vessels of the kidney are connected with the ones of the abdomen. Lastly, the kidney's ureter is connected to the bladder. After the surgery, patients spend almost a week in the hospital for a fast recovery. This is the process and the procedure for a kidney transplant.
There can be some complications to a kidney transplant surgery. One of these is bleeding and infection during the surgery, but there can also be problems that can occur after the surgery during the recovery period. This can include rejection of the kidney due to the immune system attacking the organ because it views the organ as a foreign object in the body. The patient will have to take immunosuppressants so the body won't reject the organ. But since these medications suppress the immune system's functions, this can also present further complications. Immunosuppressant medications also have many side effects, such as mood changes, higher chance of contracting infections, acne, diseases that affect the bones, hypertension, which as mentioned before is high blood pressure, and a higher risk of developing cancer.
Kidney transplants don't have to stop you from doing daily activities. Your new kidney restores normal function and you can probably return back to work within 8 weeks. However, you cannot lift weights that are heavier than 10 pounds or exercise. You must also have frequent checkups to make sure you are recovering properly. You have to also take immunosuppressants that prevent your body from attacking your new kidney. Lastly, you have to maintain a healthy lifestyle and take prescribed medications to make sure the transplant is a success.
Once a person has a kidney transplant, they might have to make many lifestyle changes. One of the most prominent ones is intake of immunosuppressant medications. Once a person has a kidney transplant, they have to take immunosuppressant medications for the remainder of their life so their body doesn't reject the kidney. If a person misses their medications even once, they would have to immediately call their doctor, since there might be a higher risk of rejection. The second change could be a difference in mindset and emotions. Since kidney transplant surgery is life-changing, it could have a huge mental effect on many patients. Many can experience guilt or depression since they feel like they have taken a kidney from someone and stole another person's chance to receive it. Anxiety and stress can also be prevalent, and it is important to seek help if needed. There is also a probability of kidney rejection, but life can return to normal after a while. This is because patients will be able to return to work after 3 to 6 weeks, but that period can also be 8 weeks in some cases. They will also be able to travel within the country in 2 to 3 months and will be able to travel abroad in 6 to 12 months. Patients can also drive and have sexual intercourse after 4 to 6 weeks. Having a kidney transplant can also help with the regularity of menstrual periods, which puts someone at a higher chance of becoming pregnant.
Since kidney transplants are one of the most common procedures, it's very important that you're educated about this topic.
This is a requested video, and if you want us to do a certain disease or surgery in the future, please let us know in the comments down below. We hope you enjoyed the video!
Make sure you like the video and turn on the notifications bell down below to know when future videos come out.
Also, make sure to share our channel and videos if you find them informative and intriguing. We work very hard on them and we hope you enjoy them.
Come back next week for a video on a relevant disease. And don't forget to check out our Instagram handle down below for Health Kiosk, our company. We're having a giveaway soon.
Thank you for watching.
Bye.